A new study is warning that the next health crisis triggered by COVID-19 may actually be a wave of suicides. The study warns that the isolation and the anxiety from the lockdown may be responsible for as many as 75,000 drug overdoses and suicides over the next decade. So we're joined now by Dr. Bob Lahita. Dr. Bob, you are in New Jersey, and I want to talk a little bit about this study because that number's pretty overwhelming. It's based on 3 assumptions. Can you just talk a little bit more about these assumptions and what they're calling deaths of despair numbers?
Yeah, these deaths of despair numbers are very unsettling, and these assumptions are that based on previous economic downturns, that is the Great Recession of 2008 and the Great Depression, that we're going to have a number of suicides, that overdoses with regard to drugs and also alcohol abuse is going to increase significantly. And the graphs from this particular study are really startling. This morning, I got numbers where our unemployment rate is now 14.7%. Basically, 20.5 million jobs have been lost just in April. So we're looking at the 3 things: unemployment, isolation, and of course the uncertainty. We don't have a vaccine. We have a disease that is attacking all of us potentially. We simply don't know what's going to happen from day to day. So economic recovery, unemployment, and geography are all of the variables that figure into these large numbers of deaths. And it varies from various parts of the country, but it also varies for socioeconomic groups. As you know, this disease, COVID-19, adversely affects people from lower socioeconomic areas, people of color, for example. The American Indian population is the largest group that is adversely affected. And socioeconomic issues are big in our society, and the number of deaths are greatest among those populations. And also, I might add that men are adversely affected more than women. And presumptively, that's because they are oftentimes the breadwinners, whereas the mother stays home to take care of the family. When a man is out of work and can't supply his family with food and even sometimes shelter, it results in massive depression. And so our mental health issues are substantial. And I think the numbers go from 25,000 to 150,000, and the mean that you have on the screen is 75,000 deaths of despair. So that's a real problem going forward.
It's on one hand, doctor, and we've talked about this, people are dealing with the very real physical threat caused by COVID-19, but now we are also talking about mental distress. And I think it's so important because oftentimes people, it feels for a lot of people as if this is something that is not brought to the forefront of people's minds when they're dealing with a physical threat to their safety. So why is understanding mental distress so important?
Oh, understanding of mental distress is extraordinary. Everybody handles stress in a different fashion. I mean, we as physicians see patients every day, and one patient may handle their illness if they have an acquired illness or something like a cancer. Some people handle it well. Many people don't handle it very well. And in a case like this, where we have a virus that is uncertain, and you can't even be sure that when you go to the grocery store, you're not going to be infected. This is very uncertain, and it causes a lot of anxiety. So people who are elderly, who are relegated to just staying at home and not going out at all, they can suffer depression significantly. They're in isolation. There's no one for them to talk to except perhaps on the telephone. They're away from their loved ones, young people, grandchildren, etc. I hear this every day. And this is a big issue. But let's take the population. Suicide, overdoses, and alcoholism occur at different rates in different age groups. And of course, in different parts of the country, you have New York City, which had a tremendous number of deaths, and New Jersey, which has a second only to New York City. And then you get out to Idaho or Iowa, where the number of deaths are less. And you have now opening of certain states, certain businesses. So employment, the economic downturn may be partially reversed, but again, it's still uncertain. We're preparing for a resurgence of the infections. So unemployment still is a big one. It looms out there. The numbers are, I think the numbers are even higher than the Great Depression. We're predicting anyhow. And when you look at geography, it really means where you are in the country. If you're in Hawaii, for example, you depend on tourism. Tourism is down. Nobody's going to go and fly anywhere at the present time. And of interest, it's important to note that the government has only given about $500 million to this problem, this mental health problem, where they've given $16 billion to the airline industry. So it seems that there's a big disparity between what is real and not real. And we're going to be facing these deaths of despair as we go forward. It may get really bad.
Doctor, I want to ask you about another study, a different study entirely that's coming out of China that found that the COVID-19 virus could be found in the semen of infected men. Does that mean that this might be a sexually transmitted disease as well?
Yes, I'm glad you asked me that question because that's been of significant interest because let me start by saying immunologically, there are privileged sites in the body that are not readily attacked by the immune system. One of those areas is the inner portion of the eyeball, the thyroid gland, the ovary, and of course the testicle. These are called immunologic privileged sites. So it would stand to reason that the virus could reside there without being destroyed by the immune system necessarily for some period of time. That being said, it's possible that sexual intercourse may actually result in transmission of the virus. And I'm trying to get data on the patient's age and how long they have had the disease. Does this virus stay in the semen for a prolonged period of time, say a week, 2 weeks, 2 months? We simply don't know. The Chinese did the study on 38 patients, and only 7 of them were noted to have the virus in the semen. But 7 out of 38 is a fairly large number. So if we extrapolate that to several hundred people, it may be quite significant. So we have to worry about that. Again, the testicle is a privileged immunologic site, as is the ovary and other parts of the body. That in itself has been very interesting. But in the presence of this particular pandemic, it's extraordinarily important to know that.
Dr. Lahita, thank you so much. As always, you provide such sound information, important information for our viewers and for ourselves. We really appreciate it. Thank you very much. Be well.
Thanks, Vlad, and thanks, Anne-Marie.
We just want to remind you, if you or someone you know is having suicidal thoughts, or they are in emotional distress, or you are in emotional distress, the National Suicide Prevention Lifeline can help. It is open 24 hours a day, 7 days a week, and it is free of charge. You just call the number you see there on your screen. That's 1-800-273-8255, 1-800-273-8255.